Good morning, and thank you for being here today. I would like to speak further about something that the governor mentioned yesterday during his press conference. Each day in our news releases, we update the number of people who are considered recovered from the illness COVID-19. For instance, today we are reporting 82% of people who were infected are considered recovered. But that just means that they're no longer contagious. True recovery, complete recovery from COVID-19, we are now seeing, can be a long process. These patients have been named COVID-19 long haulers, people who may be considered quote-unquote recovered in that they had the virus at least several weeks ago, but they are still dealing with its lingering effects on their body. In late July, the Centers for Disease Control and Prevention, the CDC, released a report on individuals who have had the virus and then what their health was like after that point. 35%, or over 1/3 of individuals who had the virus and participated in a telephone survey said that they had not returned to their usual state of health. Among people 18 to 34 years of age, younger people, who had no chronic medical conditions, 20% of those individuals reported that they had not returned to their usual state of health 14 to 21 days after testing positive. Symptoms lasting for several weeks and disability have been common in adults with severe COVID-19. But this data and report gives a glimpse into how significant the illness is for those who were younger and previously healthy. There are hundreds of thousands of Americans who are COVID-19 long haulers. As research and data has begun to emerge on long haulers, we have seen a few trends. But I want to emphasize this is new information, and we're just learning as we go along. This is a novel or new coronavirus. Long-term impacts from COVID-19 are more likely to affect women than men. A study from France found an average age of COVID-19 long haulers of 40 years of age. And many of those long haulers are healthcare workers who maybe had a significant exposure to the virus, a heavier load of virus that they were exposed to. So as we have national discussions about healthcare, the potential for people with pre-existing conditions, that possibility to lose healthcare access is just a terrifying proposition in the middle of this global pandemic. Imagine not being able to get health insurance because you were tested positive for COVID-19. And that is why I stand in support of Governor Wolf and all he has done to ensure healthcare access and its availability to all Pennsylvanians. We cannot go backwards in ensuring that healthcare access, affordable healthcare access, is available for everyone in Pennsylvania. While there is still so much that we are learning about the lasting impacts of COVID-19 on our health, we know one thing for certain. In this era of COVID-19, we are all interconnected. This virus does not discriminate, and we must ensure that those who are sick get the treatment that they need as long as they need it. Each of us have a collective responsibility to protect our communities from COVID-19. And we must stand united in this fight to stop the spread of this contagious and dangerous virus. We need to mask up, wash up, maintain social distancing. We need to, quote unquote, app up by downloading the COVID Alert PA app today, and over 173,000 Pennsylvanians have done that. And as always, stay calm, stay alert, and stay safe. And now I'm pleased to answer questions.
Dr. Levine, thank you. Do you have a number of how many long haulers there are in Pennsylvania, how many long haul patients?
So we don't have that specific information for those in Pennsylvania. This is a new field and new investigations of those quote-unquote long haulers. We would look forward to our great academic medical centers doing that type of research and perhaps shedding more light on that, and we'll look forward to that in the future.
35% of COVID patients that you did mention, that was across America, correct?
That was across America on that study from the CDC.
COVID-19 has been present in Pennsylvania for almost 7 months now, and maybe it is the long haulers or maybe it's not, but what's your main concern regarding the virus right now?
Well, I have many concerns about the virus now. I have concerns about a potential increase in cases as we enter the fall. This has been widely discussed nationally by experts such as Dr. Fauci, Dr. Birx, and others. As we go into colder weather, people spend more time indoors. Cold weather with less humidity does impact the spread of respiratory viruses, such as the flu and COVID-19. So we're concerned about potential increases in the United States and in Pennsylvania. In addition, as I alluded to, this is going to be flu season. Flu season starts usually October, and then increases as we get into the winter months. The peak of flu season is January and February, and then it decreases in the spring. So we're going to have COVID-19 in our usual flu season, and that's a potentially very serious issue. No one knows what happens if you get COVID-19 and influenza at the same time, which highlights the extreme importance of getting a flu shot this year. We're concerned about COVID-19 and its potential health impacts, as we've been discussing. We have 49 children that have had MIS-C in Pennsylvania, multi-system inflammatory syndrome of children, taken care of by our outstanding children's hospitals. So there are many concerns about COVID-19 as we enter the fall and the winter.
Potential surge, and I'm sure you have conversations with many states and the federal government probably on a daily basis. What have you seen regarding the possibility of the surge happening? I mean, we are into the fall. When could we see that, and what could it look like?
Sure. Well, we are seeing nationally significant increases across primarily the Midwest and the heartland, quote unquote, of the country. North Dakota, South Dakota, Nebraska, Montana, Wyoming, into Iowa and other Oklahoma and other states, and we're concerned about that of course spreading through other parts of the country, including Pennsylvania, the Mid-Atlantic, and the Northeast. I mean, what we would see is consistent increases in terms of new cases of COVID-19, and then impacts across our Commonwealth. I mean, we would see impacts upon schools, upon colleges. We know that the prevalence of COVID-19 in long-term care living facilities is directly proportional to the prevalence in the counties where they're located. So we have to pay very close attention to vulnerable seniors in congregate settings. And so, we have three ways that we can address a pandemic such as this size and scope. We have containment, we have mitigation, and we have a vaccine. And so we'll be working on all three of those fronts.
Speaking of that vaccine, the president continues to tell the American people, and he doubled down on it last night, that a vaccine will be ready well before the end of the year. What kind of conversations have you had with the federal government so far regarding the vaccine?
We've actually had significant conversations, myself and our whole team, with the federal government. There are sometimes almost daily meetings with the CDC and other healthcare professionals in the federal government about the vaccine, its distribution, and its administration. We, through ASTO, the Association of State and Territorial Health Officials, of which I'm president this year, we had conversations with Dr. Fauci, with Dr. Redfield, the head of the CDC, with Dr. Jawad, the Assistant Secretary of Health, with Dr. Hahn, the Commissioner of the FDA, and others. They assure us that the vaccine will be tested and will be safe and effective when it's distributed. Well, one thing that we all agree on is that there should be no politicalization pronounce it correctly, of this process, of really anything with COVID-19. But there should be no political influence on when a vaccine is ready, on its distribution and administration. We all agree on that. I think that we remain hopeful that there could be the beginnings of a distribution of the vaccine before the end of the year, but you can't set a date on science. And so the studies that prove that it's safe and effective will be done when they're done, and then we'll be ready. We are developing robust plans on, again, that distribution and the administration of the vaccine. Most likely it's going to come in three segments, a limited distribution at the beginning for priority groups such as healthcare personnel, et cetera, a wider distribution next, and then widespread distribution throughout the population after that. But in the exact timing, we don't know. We're hopeful there'll be more than one vaccine that will be proven safe and effective, but we don't know that information yet. But when that happens, Pennsylvania will be ready.
We've seen anywhere from grade schools to colleges start with in-person instruction and then have to revert to online learning because of outbreaks. From your perspective, how have schools handled reopening and resuming instruction so far in the midst of COVID-19 in Pennsylvania?
So we have had very close collaboration with the Pennsylvania Department of Education and then with many stakeholders in terms of schools, whether it's K through 12 schools or colleges. Overall, I think that schools are doing a good job. I think that they are taking the information that we give them and that are on our weekly dashboards, et cetera. They're making prudent decisions. And are working to protect the public health of their students and their teachers.
For a while, the department was concerned, and maybe you still are, about the number of COVID-19 cases, specifically in 19 to 24-year-olds, hence that decision to put more restrictions on bars and restaurants. Since that July order, I know some restrictions have been eased a little bit, but since that July order, have you seen the number of cases in that age group go down, or are you still concerned about that specific age group?
Well, so the age group that we were concerned of in the summer was a little bit broader. It was 19-year-olds, those in their 20s, 30s, even 40s. The specific concern over the last month, though, has been 18 to 24-year-olds, and that's college-age students. And we have seen outbreaks in colleges in Pennsylvania. And we reported a week or so ago that we had what we call a C-REACT team, a COVID-19 REACT team that participated in consultations and discussions with stakeholders in Center County. So we spoke with many stakeholders, Penn State, we spoke with Center County officials, with state college, local officials, and many other stakeholders in Center County. We're going to have further discussions this week about working on the number of new cases that they have in that county. And we stand ready to have further C-REACT teams go out when we deem it's necessary because of spread.
Have you seen evidence to support that those mitigation efforts on restaurants and bars have indeed paid off?
So the mitigation efforts that you were speaking about, we put into effect this summer. And that was because of the increase that had been generated from younger people, using a broader definition of that, who were primarily being impacted by restaurants, by bars, by nightclubs, by other social gatherings. There had been dramatic increases in the South, in the West, Florida, Texas, Arizona, other southern states, and that had crept north and into the Mid-Atlantic. And yes, we did. As we put in that mitigation effort with the original limitations on restaurant capacity and the limitations on indoor and outdoor gatherings and closure of bars and nightclubs, we did once again bent the curve, and we were able this summer to see a decrease in the number of new cases. So that mitigation effort was very successful this summer.
As of yesterday, more than 165,000 Pennsylvanians downloaded the COVID-19 app you were just discussing. Obviously, the goal is to boost the state's contact tracing efforts through that app. Have you seen any evidence so far that the app is doing what you hoped it would, or is it still too early to tell?
Both. We have seen some evidence that it is doing exactly what we wanted to do in terms of contacts, but it is very soon, very early in terms of the app. But we have very high hopes in terms of the effectiveness of the app. And again, we have now 173,000 more, almost 174,000 who have downloaded the app. We need more than that. The more people who download the app, the more successful the app is going to be. I personally, of course, have downloaded the app, and I think that it's a great tool in our toolbox in terms of working to contain and stop the spread of COVID-19. But it's critical to remember that we're all in this together, and we stand united in Pennsylvania.
What's your reaction to the amount of downloads it's gotten so far? Were you expecting this high volume of people to download it?
We were hopeful that we would have this high volume, and we're very pleased, but we need even more.
Absolutely. The Tennessee Titans football team has had several confirmed positive cases of COVID-19. Now, they were slated to come to Pittsburgh on Sunday, but that game has been postponed, and they're looking at possibly playing Monday or Tuesday. Have you, as the Secretary of Health, had any conversation with the Steelers organization or the NFL regarding this?
We have not. We have regular conversations with the Steelers and the Eagles as other sports teams. I haven't had any specific conversations as yet about this specific issue.
That's all I got.
Thank you very much.